Put on clean gloves.
Are those the sterile ones?
They're pretending to be sterile.
Oh, these are clean.
They're clean.
Oh,
They're
so
not
There's
sterile.
another set of gloves.
You do clean, and then you do sterile when you actually get to the suction part.
I didn't know there were two sets.
Yeah.
Okay. And then it says you'll occlude the end of the connecting tubing to check suction pressure. And then it says
So you
place,
can actually, Star Wars.
place the connecting tubing in a convenient location. If using it, place resuscitation bag connected to oxygen within convenient reach. Okay. And then it says open sterile suction package using aseptic technique. The open wrapper or container becomes a sterile field to hold the supplies. Carefully remove the sterile container, touching only the outside surface. So the sterile container should be on top, and then you just pull that out. And then set it up on the work surface and pour the sterile saline into it.
So you only need the clean gloves for this, not sterile, because otherwise you'd be contaminating your sterile gloves.
And then it says put on face shield or goggles and mask. Put on sterile gloves now. It says the dominant hand will manipulate the catheter and must remain sterile. The non-dominant hand is considered clean and will control the suction valve on the catheter. With the dominant gloved hand, pick up the sterile catheter.
So decide which one you want to stay sterile with. Okay.
So they're just pick.
Because that's sterile, you can touch anything in there. And you can use, this isn't contaminated yet, so if you need some help with that, that's all right.
And just to get off the package.
Yeah, you can. Sometimes I'll just stick it on the end, still in the package, but you can take it out of the package.
And then it says with a non-dominant hand,
Thanks.
pick up the connecting tubing and connect the tubing to the suction catheter.
Which part? This.
That's the part that goes at the end of the white, because that's what goes in the patient, that end. So you want the white end, where the suction valve is, to go there. Okay, so as at this point now, her left hand's contaminated. Or not, okay?
Okay.
Right.
Moisten the catheter by dipping it into the container of the sterile saline and occlude the wide tube to check the suction. Using your non-dominant hand in a manual resuscitation bag, hyperventilate the patient, delivering 3 to 6 breaths.
I'm sorry. Stand in front of me.
And
Be
this is
slow, like you would take, deep breaths yourself.
open the adapter on the mechanical ventilator tubing or remove the oxygen delivery setup with your non-dominant hand. Using your dominant hand, gently and quickly insert the catheter into the trachea. Advance the catheter to the predetermined length. Do not occlude the Y port when inserting the catheter. Apply suction by intermittently occluding the Y port on the catheter with a thumb on your non-dominant hand and gently rotate the catheter as it is being withdrawn.
This will, if you can get hold of the catheter so you're holding it out here rather than in this one. There you go. Then you're not as likely to contaminate the catheter.
Should just go all the way.
That won't let you go in very far. But ordinarily you would push it all the way in. You'll stimulate
Okay.
the
And then it
patient's
says
cough.
as you pull it out, you occlude the Y port and twist. And it says do not suction for more than 10 to 15 seconds at a time. And then it says hyperventilate the patient using your non-dominant hand in a manual resuscitation bag.
So wrap that up. There we go. Now if you got very little out, you're not going to do any more, that'll be sufficient. But otherwise, after you hyperventilate, you let them rest for a few minutes and then you would suction again.
Do you trach patient suction every day?
Oh, you suction as needed, really, whenever they get congested. So on some patients you may do it a few times a shift, other patients maybe every hour might need it. Just depends upon how many secretions they have.
And then you flush the catheter with saline, assess the effectiveness of suctioning, and repeat as needed.
The suction.
Yeah, fine.
In reality, you would be going a little bit further, but I know in there you can't. You can kind of roll it a little.
And then it just says allow 30 seconds to 1 minute before suctioning again. No more than 3 suctions per suctioning episode. And then encourage the patient to cough and deep breathe between suctionings. And then do not suction the oropharynx suction the oropharynx after suctioning the trachea.
Do I clean it again? And
Yeah, well, you'll probably have goop in it, so you probably want to clean it out. And then you can just kind of see if he has, because he may have coughed up. You've stimulated the cough reflex by going down there, so he may actually cough some stuff up depending upon.
And that's it.
And then you just wrap your catheter inside your blouse.